welcome back to Glitter and Chaos. This is episode 2, and we're your hosts, Caitlin Mead and
Kaylee Patton-Dieters.
I hope you guys enjoyed episode 1. That's kind of where we wanted to start and touch base and see, we'll just kind of talk about what that was like for us initially. I'll kind of let Kaylee start first on what that was like for her.
Yeah, so the first episode was, I think we learned a lot. We learned a lot that it is exactly what we thought. It was nerve-wracking to put it out there, to get it ready, to cut it, to edit it, to add intros and add music. And I can now do like very rudimentary film editing or video editing. So it was fun to learn. Like it was a challenge. And so it was really excited for me to just kind of play around with it, even though it was stressful, but it was really exciting for me to kind of learn that skill. So I'm excited to be able to maybe add some more pizzazz, like in the opening entries and, things like that. Maybe actually figure out how to get links into the video and stuff like that, but one step at a time, please. But no, I was good. I liked how it seemed very natural. We've known each other for a long amount of time. So we're able to have that conversation and we're able to just, have a great dialogue about different things and then also pivot really quickly when I change subjects quickly.
Just with a camera on us now. So, okay.
Yeah. What was your experience?
Nothing makes you realize how awkward you are until you have to watch yourself on camera. I had a very difficult time watching myself, to be honest. Like I caught myself really picking myself apart in a lot of ways. Which goes back to that vulnerability piece. I felt very vulnerable watching myself on camera and then knowing that my close friends and my family were watching and, like even having my husband watch last night and then asking for his input and being like, well, did you pick up that I did this? Did you pick up that I did this? And like, for instance, so in the preview, in the sneak peek, Kaylee clipped the part where I talked about life throwing you curveballs and then I said straight balls. And I was like, oh my gosh, why would I say that? Like I played softball for 15 years. Like there's no such thing as a straight ball. It's called a strike. And so like, I just really picked myself apart and recognized that that's a lot of vulnerability for me. So this is definitely a learning curve and a learning journey. And I think it's going to really, mess with my, I don't know how to word this. Like it's making me step out of a comfort zone, maybe not realizing that I was as vulnerable as I thought I was. Like I was like, oh yeah, this is going to be a breeze. Like it's going to be fine. And then recognizing I don't like looking at a camera. Like this feels very weird to me. I'm looking at something and nobody's looking back at me. And so it's a little weird. But at the same time, like Kaylee said, this is very natural because we're talking about things that are passionate to us and talking about things that are important. And so, and our friendship makes this easy too.
Yeah.
And so like, I don't feel like I'm having to necessarily put on a show because we're not. So this is very authentic and this is very real. But it's definitely, I'm having to be more aware of myself right now and where I'm looking at in the room and what I'm doing and things that I typically am not aware of, like being very aware of my facial features, like my facial expressions. I have a good friend that likes to point out that I need to relax my jaw and be very like aware of what my face is doing.
But was this like your first time being on a recorded, like anything?
Yeah. I mean, I did like in high school, like I was on stage and I did things like that. And that was, I don't know why that's any different than this. Maybe it's because I know that there's going to be people that I don't know.
Well, and there's nobody here. When you're on stage, there's people, in front of you that you can play off of, you can have an interaction with.
Right.
We don't have the other people on the other side going like, hey, thumbs up, or like whoop whoop, or
there's no
we don't
reassurance.
have that interaction to feed off of.
And the other part of it too is, like I said, there's going to be people that I don't know watching this, and I think that also as that reality hit me after we were posting these teasers and we were seeing the views that we were getting yesterday, I was just kind of like, oh yeah, this is going to be out there. And now I'm not so sure how I feel about that. But I think it's a good thing. And I think this is going to be a great thing once it gets going and it gets off the ground. It's just getting there. Yeah. And so that's kind of where we're at. So, yeah, deep breaths. Deep breaths, Caitlin, deep breaths.
It will all be fine.
Yeah.
It'll all work out.
Yeah.
It's okay.
Yeah, it's going to be great. I think it's just something new.
It is.
Something new, and I think stepping into private practice, not something that I expected, but a fun part of it, a twist to it.
A more creative piece to it to kind of
something
work
to add to our repertoire.
In parallel to it,
Yeah, absolutely.
Yeah.
Absolutely.
So we have a specific thing we're going to kind of cover today. Mental Health America every year puts out like a global report of just kind of the status of mental health in the United States, and then they break it down by states. And so across this episode and the next episode, we're going to be breaking down that particular report. The one thing that I really did like about this report this year, because I've been following it for a few years now, is at the very beginning of the report, they have all of their references. They talk about their research methods. They talk about where they pulled their information, and they have the links and they have the references. And that was really important to me because I want to know where they're pulling this data. I want to be able to go and look at the population sizes, the sample sizes. I want to know like who were they really looking at in these versus just these generalized statements, because that's sometimes what it can feel like, is just these overwhelming news headline kind of statements, but what's behind it? What's guiding this? What's informing this? And so I was really proud of MHA this year and how they did that. And so one of the biggest ones that, Caitlin and I found out of this report that we wanted to talk about today is the coverage or lack of coverage. So do you want to share that?
Yeah. So one of the things that we really zeroed in on was where Kansas fell. Because obviously we're practicing clinicians in Kansas and the populations that we work with. So for those of you that aren't local to where we practice in, we are in a rural setting. And access is already very limited in a rural setting. Luckily for Nemaha County, that is increasing. We're getting more providers. We're getting more access to these providers because I think it's becoming more prevalent. It's becoming more talked about because luckily we have a pretty supportive network up here. Yeah. In that it's being talked about more because of events, because of things that have happened, unfortunately, within our community. But also because we have pretty loud voices. Those of us that are really
passionate, but we also have really good community providers that we also bounce off of, and we work in tandem with. We're very lucky. I think in a rural area we're just very lucky on how community oriented where we are located. We have the capability to reach out and say, hey, what have you heard about this? Or, hey, what do you think about this? Is this something maybe we can, work on together? We can collaborate together. Or, hey, I really like what you're doing. That's fantastic. It's a really supportive environment to where we can really collaborate with each other. And I'm not sure everybody gets that experience. I'm not sure everybody has that experience in their local communities or with their community partners. And so, I just want to, before we kind of get into some of the rankings, I just wanted to say that we really live in a really cool community.
Oh, absolutely.
And the larger surrounding communities of rural, of the other rural communities too. So, because we talk with multiple different providers across different counties, we have great relationships. And so again, we are very lucky, the little network that we kind of have here.
Well, and we all refer to one another. And so it's very much like, hey, I might not be able to provide this service, but I know somebody who does.
Yes.
And so at the end of the day, the end goal is always, how can we help these people?
Yes.
And how can we help one another out? If it's not me, then I want to find somebody for you who can help you. And that's always our end goal.
Yes.
And so I feel like all of our providers are very collaborative in working with one another. to do that, from our family practices to down to our therapy clinics and all the things.
Yes.
So that brings us to the access of care. So the first part that I really want to touch on is this was broken down into 51 states. And I'm not going to get into the 51 thing, because I'm,
for all intents and purposes, 1 out of 51 is what we're working.
Yes, so that's the
1
point.
through 51.
So there were 10 measures that make up the access ranking. I'm going to just touch on a few, the ones that we're going to touch on today, and then episode 3, when we go into part 2 of Mental Health America, we'll touch on the remaining factors. But the ones that we're looking at today were adults with mental illness reporting an unmet need for treatment, adults with private insurance that did not have mental health coverage, youth with mental health illness that did not have coverage, and looking at where Kansas falls in that. So states with rankings 1 through 13 provide relatively more access to insurance and mental health care, where states ranking 39 to 51 provide relatively less access to insurance and mental health care. Kansas falls at 31. So we're kind of right in between that ranking.
Yeah.
Which I think shocked both of us a little bit, because it's not good, but it's not terrible either. I would love to be in the 1 through 13.
That would be fantastic if we could get up in there. Right. And we'll get into a little bit later, but and what we can do is we can also link this report if you want to read it all through, which I would highly encourage if you have the time, and ability to do so. There are some other measures where we are in those 1 to 13s. So that was really shocking, but was also like, yes. But yes, being 31 is kind of right in that middle point, and we would like to see it a little bit higher if at all possible, which I think we're making, hopefully good steps towards doing that. But yeah.
Well, and then looking at, and again, this is what's being reported. So we have to remember too, that when we're looking at these numbers, not everybody participates in these surveys or in these measures. No. So we have to remember that some of this stuff is very underreported.
Yes.
That was, so take this with the understanding that there is a margin of error.
Yes.
When we're looking at the adult prevalence of mental illness, Kansas falls at number 23 with the report of mental illness in adults being at 519,000 adults in the state of Kansas that experience any mental illness. That's a pretty high number.
Yeah.
But again, we're kind of riding right in the middle. We're right in the middle of the 51 that it's measuring, which also was shocking to me that we weren't, and maybe it's because we work in the field that we do. I expected us maybe to have higher numbers reported.
But again, it's the reported.
Right.
And we are at the unique juncture where while mental health stigma is getting better, we're still in the rural areas.
Right.
And we still have a lot of work to do with mental health stigma in the rural areas. There has been a lot of great local initiatives with the addition and support of 988 that have decreased the stigma and are increasing, encouraging people to reach out and to talk about what's going on, reach out to their friends, reach out to family saying, hey, I'm struggling, I need some help. So there's been a lot of great local initiatives, but that stigma is still there. And so especially when you're thinking about the rural areas, which would be another really great research point, is to look at the rural areas or frontier, which is kind of how Kansas is broken down, looking at the statistics of the rural and frontier areas. But this doesn't get that finite.
That would be interesting to do, though. That'd be interesting.
Maybe that's
our next project.
Maybe a future idea.
Our next project. Stay tuned. This next one's near and dear to my heart because I work with a large age group, a variety of age groups, but I am very predominantly with youth and teens. And so when we're looking at the youth prevalence of mental illness, The overall number in the United States that was reported was 4,860,000 youth with a reported mental illness. I can already tell you that number is way too low. That again is reported. Kansas falls at 26 with 48,000. Again, right in the middle, but I can guarantee you that is low.
Yeah.
That from what just in our area, like in the county in Northeast Kansas, what we see, and I'm talking about not just like this county, but I'm talking Topeka, like all of those areas. That number is not an accurate representation of this entire state. Like I can tell you.
Yeah.
And so.
Well, and we're also looking at a delay in research as well.
Yeah. I mean, this was back in 2023, 2024.
Yeah, most of it. So most research when it comes out, when you're looking at reports like this, is about a year behind.
Yeah.
Year is like, hey, that's fantastic. It's at least a year. Usually it's 2 to 3. So.
And we've had a lot happen in the last year since this has occurred.
Yes.
And so we know that things have changed. And I'm sure that this is
a snapshot in time.
Right.
This is a snapshot.
So take that with a grain of salt as well. The next thing that we really wanted to look at was, okay, now that we know these numbers, what about the coverage? What about the access to care? And looking at adult access to care, people that are uninsured in the state of Kansas, I have to find that. I apologize. It was here. Okay, so in the state of Kansas, we're at number 48.
Not great numbers.
For adults.
Not great numbers.
88,000 people who are uninsured and do not have access to care. For a mental illness. That's a pretty significant number. And again, probably underreported. And we see that. I mean, we see that, and then that brings to question: how many people outside of this number are not getting help?
Yeah. It's startling sometimes to see that number.
Yeah.
And to hear that, Kansas is 48 of the 51. Like, we have a lot of room to grow there. We have a lot that we need to get done to help support people in our communities to access care, to have the ability to receive care, to identify the barriers to care, like what's going on, like why are we not being able to access certain care, like points, basically.
Well, and I'm throwing a lot of numbers, like we're throwing a lot of numbers at you guys today, but it's so important because we want you to see the crisis that we're in, the dilemma that we're in. So adults that report 14 plus mentally unhealthy days a month who could not see a doctor because of costs, Kansas ranks 37 with 98,882 people who won't see a mental health provider or a doctor or can't because of the costs. And even those of us with insurance, like looking at medical bills, it's insane.
They're still prohibitory. Even if you are insured or if you are underinsured, there are still barriers to access of care with insurance.
Yes, and we're going to touch base on that next. So, private insurance, I think there's this misconception that private insurance is going to cover things.
Yeah.
It's going to cover mental illness. Yeah, my private insurance should cover that. Wrong. Private insurance doesn't always cover what you think it should, what you think it would. It'll cover some things that you're like, when would that happen? So
yeah,
that occurs. When we're looking at adults with an adult mental illness whose private insurance does not cover treatment for mental or emotional problems, Kansas fell at, we were higher up on this list, I feel like. We fell at 12. So for adults, that was 15,000 people whose private insurance didn't cover. Not terrible.
No, we're still in that 1 to 13. So,
Yeah,
I mean,
we're in that 1 to 13.
This is one of the ones we were higher up on.
Right.
So,
for youth, we fell at 2.
yeah, we were really high on this one.
The youth, we were at 6,000.
Yeah, we were really high on this one, which I was really, really excited to hear that one.
Yes.
That one was fantastic.
Yes, and that's great. So there's definitely benefits to private insurance, but we know that not everyone can afford private insurance.
Not everybody has access to that level of, to that type of insurance. Yes.
Right.
And even then, there are so many policies and plans that it's hard to navigate sometimes. It's hard to decide, is this going to be helpful for me? Is this going to, is this deductible going to be worth this monthly payment? What are the covered services? There's so many different things with insurance. Like, we could probably spend a whole episode or 3 on them, which we're not going to, because that's not something we're going to get into. But having that number 2 was really, when we saw some of the harder numbers, that was like, okay, there's at least one.
There's at least one yeah.
We have. That's kind of a bright spot.
Well, but there were 2. Like, adults were pretty decent.
Yes.
And children. And I, want to point out too, like, we're seeing, when you see, and like Kaylee said, we're not going to get super into it, but like, you see the limited access to the private insurance because premiums are so high. And then we are running into different issues with Medicaid and things like that. And that causes limited access to care too.
Yeah.
And so ultimately, I guess the whole point of what we're saying is there can be this misconception with state, Medicaid insurance and private insurance that is, oh, well, I'm covered.
Mm-hmm.
Well, these numbers indicate already right now that
yeah,
you're not automatically covered, or not everybody qualifies.
Mm-hmm. Or your provider may not be in network.
Right. And that's a big one that we run into as well.
Yeah.
So then I'm going to have Kaylee touch base on the mental health workforce availability.
Yes. So this number, I think, and I don't know, I guess this is kind of one of the numbers that stuck out to me the most in this entire report. Now, there's a lot of great numbers in here. Don't get me wrong. There's a lot of good things that we can learn from this report. But this one was the most startling for me. It was for every 320 people in the United States that experienced some sort of mental health challenge, there was one provider. And those providers that were included in that number was a psychologist, a psychiatrist, mental health, licensed professional counselors, social workers, mental health therapists, or marriage and family therapists, rather. And so, and there might have been one more, but the main 5 that you would see with mental health services were included in that number. One out of 320. That's a lot.
Well, yeah, I just sit here and I think about like ratios in daycares.
Yeah.
Like you have like, I don't even know what they are, but they're usually like 1 to
2 or 3 or something, depending on the age group.
Yeah, depending on the age group, it's like 1 to 5 or 1 to whatever.
Mm-hmm.
And 1 to 320.
Yeah.
Like,
that was very sobering.
Well, I know how many like are on our caseloads.
Mm-hmm.
And
then I start looking and counting all of the providers that we have in the general area.
Mm-hmm.
And it's like, sometimes it's daunting. Sometimes it's just overwhelming, because it's like your heart breaks because you want to help all of these people. You want to help people feel better. You want to help people have fulfilling and full lives. And then you look at that number, and it's just that like pit in your stomach of, oh my gosh, like what can I do?
Well, it goes back to that feeling of not enough.
Yeah.
It goes to that feeling of not enough. And it goes to that feeling of like when people call in and they want seen, and you're like, I'm sorry, I have a wait list. And then it's like, everybody has a wait list. And then it's, and again, it goes to that helpless feeling of somebody shares their story with you about why they want services or whatever. And you're just like, I want to help you so bad. Like
your heart breaks in the moment.
Yes. And then you go to that place of, what more can I do?
Mm-hmm. Yeah.
Like what more
who
can
I connect you with? Who can I who can I send you to? Who can I get you?
Who can I beg?
Yeah. And it's just in the moment, your heart just breaks, because you're like, there's only one of you. There's only one of us. There's only so much that you can do, and it's just heartbreaking. It's just really heartbreaking when you have to tell someone, I have a wait list.
Right.
And then it's just, all right, well then let's see who we can get connected to. Here's our list of people. Try these. Well, I've tried them. Okay.
Right.
And that's hard because sometimes we are the third or fourth or even second call, and they're like, yeah, they referred me here, and then and we have this little kind of network, which is
This
great, which we're supposed to.
Of like,
and it's hard because you're like, well, okay, who do I, where do I go to next?
Right.
And so then it's, of course, providing like crisis lines and things like that, but that's just kind of the reality of where we're at. And then we look at Kansas's number, and it's even more startling and sobering. So remember, it was one provider to 320 people in the United States. In Kansas, it's 1 to 420. And I could get chills just saying it out loud because it's.
Can you imagine 420 people? Like, you're responsible for 420 people.
Well, it's not the responsibility. I mean, yeah, okay, I get what you're saying there. Yes.
But like, if that was our ratio.
Yeah.
Like, if that was, here's 420 people for you to see.
Yeah.
Can you?
You can't. Like, there's no capability.
Like, it's not humanly possible.
No, it's not. And that's again, it contributes to that feeling of kind of helplessness of like, I don't know how to help this individual. Like, there's only like one of you, one of me, one of any other provider that, we, refer to. And it's like, we can only do so much. But then it's like all of the, there's still more people that need help. And it's like I said, kind of a helpless feeling at times when you want to help.
Well, and that's so kind of going off the fly here of like what our little outline was when we're talking about.
That's my thing, not yours.
Well,
that's my thing.
Switching gears, going on to our name, Glitter and Chaos. So that feels very chaotic.
A little bit, yeah.
And how do we take care of ourselves? Like, how do we get out of that helpless feeling?
Mm-hmm.
And that's a conversation you and I have very frequently, which is, I want to help. I want to help. I need.
How can I help?
Like, how can I help? How can I do this? Because I think it feels like a constant crisis for us in a lot of ways in this shortage of providers. Because the phone's still ringing and the emails are still coming. And we welcome that. We want that. We want to help. Like, we want to be there. That's not, trust me, we're not complaining about being those people. It's that place of, I wish I could do more.
Yeah.
And so it's balancing, how do you continue to help the people that you're already helping, knowing that people are still calling and people are still wanting help? And how do we navigate all of this without throwing your hands in the air and going, well, how are we making a difference? Like, what are we?
Yeah. And then that's when we have to step back and say, we're doing the best we can in this moment in time.
Right.
We're doing our best. We're doing what we know. And, if we learn something new, then we do better next time. Or if we learn of another resource, we add it to our list. I mean, that's just kind of the reality. But yeah, we just, it's part of taking care of ourselves so we can maintain and help take care of others too. Yeah. It's that, oxygen mask on the plane. You have to be able to
put yours on first,
breathing to help other people breathe.
Yeah. Sometimes I need that reminder that I need to still work on myself, which I think all of us need that. Like, even when you're not in the helping field, whether you're a mom, whether you're a wife, whether you're a dad, whether you're whatever role you play in life, you need that reminder of, you need to take care of you before you can take care of other people.
So I think that this is kind of a good place to take a break on the mental health. Like Caitlin said, we've thrown a lot of numbers at you.
Yeah.
And I want some of that to digest. I want to have, I'm hoping that, this will settle, we'll think about it, and we'll see how this, just how you react to it, And if you want to share, that's great. If you want to keep it personal and private, that's absolutely okay too. We are always interested in learning more about mental health and how it's showing up in the world and even locally. And we'll continue to, digest the report in the next episode as well. But
we
I think
invite
this
you
is
to
a good
comment
break.
on Instagram, on Facebook, whatever, what your thoughts are. Engage in that conversation with us. We're going to be active on those pages. But I would really encourage you to engage in that conversation and to share your thoughts, because this isn't just today was heavy. Like it's heavy.
Yeah.
And please understand that like our episodes are not going to just be like, hey, let's talk about really heavy topics. Like that's not what this was created for.
No.
But this was literally an article that came out and we thought, oh my goodness, this is something that I feel like we need to talk about, or we felt like needed to be discussed.
Yeah.
And so that's kind of the direction that we headed in with this. But please also know, like, we also want this podcast to be lighthearted in some ways too.
Yes.
And so know that there will be, even as we talk about these things, there's going to be some lightheartedness to it. But these are things that need to be discussed. Yes.
There's a balance with everything. And so right now, maybe the information's a little bit more heavy, but there will be some lighter as well. And that's with anything. There's a balance with everything.
Right.
There really is. So.
Right. Well, thanks for joining us today. We can't wait to see what your engagement is and see what your thoughts are on today's episode. Yeah. And we will see you in a couple weeks for episode 3. Hope you guys have a fantastic day.
Thank you.
Bye.
Bye.